Okay, so let's cover verbal behavior. And verbal behavior was basically introduced by our B.F. Skinner. He wrote a book that was called Verbal Behavior, and Skinner believed that communication is a behavior. He called it verbal behavior, and he broke verbal behavior down into verbal components, and he called them verbal operants. Before going into the verbal operants, I just want to explain more about B.F. Skinner. So he basically said that communication is a behavior because there's always a listener. Most of the time there's a listener, and it serves a purpose, or it has a function, because usually when you communicate, there's a function. You get some kind of reinforcement afterwards, and it could be attention, it could be an item, it could be social, which is considered also tangible, because social activity is a tangible. It might even be an escape from something. So communication can be a behavior that has different functions like any other behavior, and we did speak about the four main functions of behavior. And he also said that the listener, if the listener is there, then it's a behavior because there's someone who's listening to what you're saying. And he did divide verbal behavior into four components, or he called them operants. And the first one is demand, which is a request that you make. And it could be a request to get something, like I want a cookie. It could be a question about something, like if you ask about direction, how to get to a certain place. That's a question, and that's a request to get some information. So that's also considered a demand. Tact is when you label something. So we have a lot of kids who would be walking in the street and they would see a dog and they see dog. Now they're not requesting anything, they're labeling it. And most of the time the parents are there, so they are interacting with their parents by tacting or by labeling what they're seeing. Echoic is basically repeating of words or imitation of words, and echoic has to have usually an SD, a discriminative stimulus, which is usually someone modeling the word. So when I ask the child to say cat, I'm saying say cat. Say cat is an SD, or a discriminative stimulus, for the child to imitate it. So echoic always requires an SD or a person to model, otherwise it wouldn't be an echoic. Okay. Interverbal is having a conversation. So if I ask the child, how was your day today? And he goes, it was good. That's that's interverbal, because he's answering a question that has, it's not a request. The child, he's answering a question, and if he's answering, it's interval. But also, if he's completing a sentence, or he is completing a word in a song. So if I say the wheels on the bus go round and the child complete the sentence by saying round, this is interverbal because he's completing something. So again, also interverbal needs to have a verbal SD. When you go back to demand, demands might not have a visual SD, because you could be asking for an item that's not there in the environment, so you might not be seeing it. So demands not necessarily require an SD. Sometimes they do if the child is seeing something like a toy and then he starts asking for it, then the toy that he could see is a discriminative stimulus because it's in front of him. Tact always require a visual SD, because tact is labeling, and there's no way you'll be labeling something that's not there. So tact always requires an SD, a visual SD. Okay, so these are the four main operants. There are more, and sometimes we use demand, tact, echoic, and interverbal to teach communication, conversation, social skills, and it's such a very neat way or method to use to teach communication, because it depends on the child you're working with. Really, if the child, say for example, is able to tact, which means label, and you want to teach him to request items, he's already labeling. So what you might want to do is you find what he really like best and could be used as a reinforcer and put it in front of him, and when he labels it, then you give it to him. And then now you are intermixing or mixing tact with mand, or transferring tact to a mand. And so this item before was an SD for tact, now it's an SD for a mand. And after you're done with the mand step, where now he's able to request all the items he could see, now you're gonna try to move these items to a place where he could not see them, and you might want to see if he will mand for them. And if you start manding for them or requesting them without their presence, then you are doing a good job, because that means you had moved this kid from a tact step of labeling to now a requesting step. Now he's no longer labeling the items in front of him. He is requesting items without the SD, without their presence. So he moved to the next level. Also, you have kids who are speech impaired, and they might not be able to say the whole word, and use shaping, and you may be using shaping, and we had cover shaping in a way to make them say the word I want, or the phrase I want, you are able to do that because they have a CoOp. They're able to imitate the sounds, and by imitating the sounds, eventually after doing a lot of trials with them or naturalistic teaching, they eventually are able to say I want clearly, and then you had used a CoOp with them, which is something that they were able to do, but in close approximations to the main goal, because it would not be helpful in any way to start with a mand or a tact if the kid is still in the echoic stage where he's just saying sounds and repeating sounds. Now, interverbal is a last step where the kid is now able to request a label to complete a sentence, or is able to provide a whole sentence. Then you can start introducing an interverbal where the kid now is answering questions like, how was your day? What is your name? Or usually with little kids, we would use interverbals for them to complete a song. So we would sing the first few words, and then they complete it. That's the beginning of interverbal. So here it says these operands are used in many ways to teach language and speech. They are used in PICs to help in functional communication. They require a listener, as they are behaviors that are always reinforced by a listener. And that's true, because if you're labeling something, you're labeling it most likely for someone to hear you, and maybe it's a good job, or maybe say, yes, that's a cat, that's true. It's a form of communication with parents or siblings. Also, mad is that when you request something, you get it. So it's a behavior then the function of the behavior is tangible because you're getting what you're asking for. And echoic is the same thing. You are communicating with someone by repeating what they're saying to you. And of course, interverbal is definitely socially mediated because you're having a conversation and you're answering someone's questions, or you're singing with someone. So it says, usually to teach language, we look at where the kid or individual is at and assess his language skills to decide which operand we should focus on or introduce and in which order. So that's what I was just mentioning before. You need to know your child or your client, what they're able to do to build on. You might want to stay in the step of echoic for some time until they are able to talk in words, and then maybe you will move to labeling from like items in front of them, and then move to mand where they are requesting the items they now know how to label. It's such a nice I would say method. It's very organized. Now let's talk about PECS, Picture Exchange Communication System. It's one of the ways you can teach communication, and it focuses on children who might have speech impairments or are nonverbal, but also with the verbal kids who do not initiate communication. And there are 6 stages to PECS, and it's if any of you have seen it, it looks like maybe you have a PECS book where you have all the items that the kid likes or the kid does during the day. It has pages of pictures and Velcro, and your main goal is for this kid to be able to use the book independently to initiate a communication, communication with someone, to request an item using the pictures exchange, and eventually some of the kids who are not very verbal, they become very verbal because they have the book with them all the time. And the main point of it is to use language eventually. So the people who are practicing or teaching PECS will focus on the child's speech in the late stages, not in the beginning stages. The beginning stages are focused on communication and using the book independently, when with different people. And then it focuses on saying the words presented in the pictures, and hopefully at the end, communication skills, and let go of the book or the PECS. And then you are able to communicate even in short sentences. So it's such a great, as I said, system in place, especially with kids who have a limitation in their verbal skills. If you want to know more about PECS, you can go to pexusa.com, and they have trainings that you can attend. Alright, so I think I already mentioned this. Oh no, actually I didn't. So this is an example of verbal training, and it tells you how you can, this is not PECS, I'm going back to how to teach communication in general using MANs or Tacts. And this is a child, so you want to teach the word open. You can provide a closed jar of cookie to a child who really loves cookies, and wait until he says open to open the jar. So you're doing this with someone who probably knows the word open, he doesn't use it, or he doesn't verbalize as often because he doesn't need to. Some kids, unfortunately, are given everything, and they're not pushed to talk. Parents know what they want, and they might just give it to them if the kid point at the thing. Some parents make everything available in front of the child and in their sight, so when they see it, they just have to point at it. And sometimes kids do not have to use language to communicate, and that could delay their language. So what we do is we do the opposite. We are to give the child, say, a jar full of cookies, and we know that this child definitely likes cookies, and make the jar maybe hard for him to open, for him to request someone to open it. Now, it depends on your child. If your child is really struggling with sounds, he might give you an eye contact, he might whine, he might point at the jar. At this point, you want to teach a CoOp, and you could say open, and the child will say it, or even imitate it as much as you can. And of course, you have to enforce it by opening the jar. Remember, when we're trying to teach a new skill, we must always reinforce. So you cannot demand of the child to say it correctly for you to open the jar. You must reinforce it even if he tries. Okay, that's the child, still in the echoic phase. You're just imitating sounds. However, if you know that the child knows how to say open but he's not saying it, you must provide an opportunity, like a closed jar, for him to say it. And you must, again, wait for the child to say it. Okay, and this is, by the way, an example of incidental teaching. It's not discrete trial where you're sitting on a table and you're giving the child trials to teach the word open. You can do that too, with maybe a flashcard, or a toy that speaks the word and he can imitate it. But this is incidental teaching, where you create opportunities in the environment for this child to communicate. And opportunities meaning things that could be inside but out of reach, so he would ask for it. Things like a closed jar. Maybe you can give a coloring book, but no crayons, so you can ask him what's missing. And then he could tell you crayons, or you start looking for it, and it depends again on the stage. If he's not able to say it, you can model it for him. If he's able to say it, you must ask him to say it, and then give him the crayons. And of course, all the objects you'll be using should be things that are reinforcing for the child, because otherwise he would not be interested, and then there's no point for him to say anything that you want him to say, because they're not something that he's not required. It's not something that's of interest to him, so it wouldn't be a reinforcer, and therefore he would not, and the next time he would not say it, or he would not mend or use a CoOp with you to get what he wants. Make sure before you start verbal training is to be able to identify these kids' reinforcers or reinforcements. Also, make sure you use a variety of them, because you don't want the kid to get bored or satiated, which means, he had enough of something, so he's not going to be reinforced with it anymore. So just a variety of toys, of activities, things that you want him to say. You can use verbal prompts, visual prompts, so it would be an opportunity for him to learn different words and to use them to get what he needs or wants. Okay, and here's just the types of ABA training: incidental teaching and discrete trial training. And you could use the language or verbal training for either. Okay, usually discrete trial training with verbal training would be more of a CoOps, to make the child, maybe you want to give a visual and ask the child to repeat, and at this point you're just basically teaching expressive skills for the kid to identify objects or academic skills. Okay, so this is verbal training. It's not really part of your task list specifically, but they do ask us to talk about skill acquisition, and it is part of skill acquisition where you're teaching a child or even a client, an older client, skills which has to do with his verbal and communication abilities. Thank you, and the next one will be on behavior intervention plans, and we're still talking about programs. Okay, we talked about task analysis, we talked about shaping and chaining, and discrete trial. These are all programs of teaching skills. Now we're going to talk about behavior plans, and this is geared towards behaviors. We're also going to talk about behavior reduction plans, how to reduce the behavior, and that's when we use differential reinforcement of alternative behavior, of other behaviors, of incompatible behaviors, all the DRs that we have. Thank you.